வாலிபனே வீர்கொண்டு தலையை தூக்கி உயர்த்திடவா, உடல் சோது நீக்கவே மனம் தளராமல் முன்னேறிவா, உன்னாவியை உயிர்ப்பிக்கவா, வாலிபன் நீ கொண்டு வா, உன்னாவியை உயிர்ப்பிக்கவா, வாலிபன் நீ கொண்டு வா. வாழ்வில் அர்த்தமற்று வாழும் இளைஞனே வீறு கொண்டு ஏலந்தோடிவா, வாழ்வில் அர்த்தமற்று வாழும் இளைஞனே வீறு கொண்டு ஏலந்தோடிவா, பலவான் கையில் அம்புகளாய் நீ மாற எழுந்தோடிவா, பலவான் கையில் அம்புகளாய் நீ மாற எழுந்தோடிவா, இளம் ஆண்கள் கிறிஸ்தவ இயக்கம் வேதத்தை மையமாக கொண்ட இயக்கம், இளம் ஆண்கள் கிறிஸ்தவ இயக்கம் வேதத்தை மையமாக கொண்ட இயக்கம். பாதைகள் இருந்தாலும் உறவுகள் உன்னை விட்டு தூரமாய் பெருகி போனாலும், அன்பில்லாத ஒன்று கைதி அடிமையாகவே இருந்தாலும், உலகமே உன்னை வெறுத்து தள்ளி உனக்கு தூரம் விட்டு போனாலும், பயத்தை விட்டு விட்டு தோல்வியை விட்டு விட்டு குழப்பத்தை விட்டு விட்டு போனோடிவா, பயத்தை விட்டு விட்டு தோல்வியை விட்டு விட்டு குழப்பத்தை விட்டு விட்டு போனோடிவா, ஒன்றாக இணைந்து உலகத்தை ஜெயிக்கலாம், உலகத்தையே நாம் கைக்குள்ள வைக்கலாம், ஒன்றாக இணைந்து உலகத்தை ஜெயிக்கலாம், உலகத்தையே நாம் கைக்குள்ள வைக்கலாம். YMCA ஒரு வாழ்வில் முதல் படி, YMCA ஒரு தந்தாரிகள் வெற்றி, YMCA ஒரு வாழ்வில் முதல் படி, YMCA ஒரு தந்தாரிகள் மூச்சு.
On behalf of YMCA Madras Kilpauk Branch, we cordially invite you all for the webinar on Know Your Foot in Diabetic Mellitus to know your foot in Diabetic Mellitus. On behalf of YMCA Madras Kilpauk Branch, we extend a warm welcome to all the dignitaries. We have with us our President, Advocate M.J. Martin Kennedy, sir. We would also like to thank our General Secretary and CEO, Mr. P. R. Pandian, sir. We have with us our Chairman, Reverend Dr. N. Duriraj. So we have with us our Secretary, Mr. J. Eric Christopher, sir. And now we have a very, very special guest with us, the eminent for frontline learners. We have a Dr. Prof.V.B.Narayana Murthy, sir, consultant plastic surgeon, Kauvery Hospital and SMF. He is the resource person for the day. So audience, you are going to have a very great time and you are going to gain a lot of insights from our resource person. Thank you, Doctor, for joining us. And we would like to share a very special thanks to all all the participants who are watching this program around the world. To start with this function today, we have with us opening prayer will be led by Mr. Rajanan sir, the committee member of YMCA Kilpauk Branch. Now, may I request Mr. Rajanan sir to render to lead us in prayer.
Okay, dear friends, let's lift the Lord in prayer. Father God, we thank you for this lovely day that you've given us, O Master. The climate is so beautiful. You gave us a good night's sleep and woke us up from our refreshing sleep, O Master. And we are here to hear a wonderful message from you, O Father. We thank you for this time that you've given us this technology, even in the lockdown time, to meet in this fashion and to be able to spread the message of your love and the message of Diabetes Mellitus, O Father, to the world around, O Father. We thank you for the platform that you have given us. We thank you for all the dignitaries over here. In a special way, we commit the resource person into your hands, O Father. We pray that you will grant him the wisdom to speak the right words so that it may reach millions and millions of people and be beneficial to them, O Father. This dreaded disease, O Father, we pray that it will be useful to everyone who hears it, O Master. We also pray for the people who are participating in it. Let them take away a lovely message from this webinar, O Father. Once again, we come at this time and the platform and every single activity and the tech team behind it, O Father. Into your hands we commit everything. In Jesus' name we pray. Amen.
Thank you, sir. Thank you, sir. Thank you, Rajan sir. Now we have with us our chairman YMCA Kilpauk, Reverend Dr. N. Duraraj, will welcome the gathering.
Very good morning to you all. And it is my privilege as the chairman of Kilpauk YMCA. I greet you all in the name of the Lord and Savior Jesus Christ. And also we welcome our YMCA president, Advocate M.J. Martin Kennedy, and for sparing his valuable time with us this morning for this special program of webinar on diabetic mellitus. And also we welcome our guest speaker, Prof.V.B.Narayana Murthy, and consultant plastic surgeon, also director high care, and also the member of vice president, Diabetic Food Society of India. We welcome you, sir, on this program and sparing your valuable time. And also we welcome our committee member, Mr. Rajan, and also we thank you, sir, for your august presence here, and also we welcome our secretary and also other people, and also in Chennai and all the various parts of the city and overseas also they are watching this program. I hope that this program will be a wonderful eye-opening program and also very useful program. And also thank all the efforts taken by the branch and also our county members and the branch members as a whole. Thank you all. We welcome you all. Others, some of people couldn't join the program. Welcome all the people who are watching this program elsewhere, and also thank you very much. God bless you. We hope you'll have a wonderful time today. Thank you.
Thank you.
So now we would like to thank our chairman for welcoming all the guests. Thank you, Chairman, sir. And now we have about YMCA. For some of you, it will be new about YMCA. I am Dr. Doreen Robin, YMCA Kilpauk Committee member and Vice Chair for the Cultural Committee. YMCA is a worldwide voluntary movement for both men and women with special emphasis on genuine involvement of young people. The first YMCA was started in London in the year 1844 by Sir George Williams. There are more than 15,000 local associations with 45 million members in about 130 countries. YMCA Madras is a 130-year-old international organization founded by Mr. David sent by the International Committee of YMCA of USA and Canada in the year 1890. It is a social services and non-government organization. Mainly, YMCA focuses on sports, education, health, environment, youth, and women empowerment. It mainly focuses through body, mind, and spirit. There are 7 branches of YMCA Madras, YMCA Esplanade, YMCA Roypeta, YMCA Veperi, YMCA Kilpauk, YMCA Kodambakam, YMCA Kotiwakam, and YMCA Royapuram. The YMCA Madras has the following community centers. They are YMCA Community Center Egmore, YMCA Community Center Satmanagar, YMCA Community Center Thandayapet. The YMCA Madras is providing free education. I repeat, YMCA Madras is providing free education to the underprivileged students at YMCA Boys Town High School, Fort, and YMCA Boys Town Higher Secondary School, Kochiwakam, and running YMCA Boys Town Destitute Home for the underprivileged students. The YMCA Madras has involved in many social and disaster recovering activity like constructing 150 houses for the tsunami affected areas at Kadalur, and we have adopted 3 villages at Nagapattinam for constructing 100 houses and community hall for Gaja cyclone affected area. The YMCA Madras has played a vital role in COVID-19 during this season by distributing foods and grocery kits to the police officers and to the general public. The YMCA Kilpauk Branch is located at 52 Halls Road, Kilpauk, Chennai 10, Tamil Nadu. Currently, Mr. Eric Christopher is the secretary and Reverend Dr. N. Duraraj is the chairman of the branch. The facilities available at YMCA Kilpauk branch are tennis. We have a tennis court. We have got shuttle badminton, table tennis facility, chess, skating, karate, kung fu, volleyball, billiards, and snookers. And also we have spaces for hostel students. Okay, we provide hostel for the students who stay near Kilpauk and in Chennai. Dear audience, this webinar is the second online program of YMCA Madras showing concerning towards the public health and safety, especially on diabetic mellitus for the day. We thank the President of YMCA Madras, Advocate Martin Kennedy, sir, our General Secretary and CEO, Mr. Asad Pandan, sir, and our Treasurer, Dr. Vincent Selvakumar, sir, and all the board members of YMCA and committee members of YMCA Kilpauk Branch for their constant support. So you would have got an entire view of what is YMCA. Some of you are new to YMCA Madras, and there are memberships available. If you want to become a member of YMCA, you can contact us and get benefited. Now we have with us our president of YMCA Madras, Advocate MJ Martin Kennedy, sir, to render the presidential address. Over to our president.
Good morning. Can you hear me? Hello?
Yes, sir, we can hear you.
Yeah. Good morning to one and all. And it's a wonderful, pleasant morning. Chennai is drizzling. Okay. And on this occasion, I would like to thank the General Secretary Asif Pandey and Reverend Dr. Duraraj and Robin sir and the madam who is also announcing, and Eric Christopher, and also our important chief guest, Dr. Professor V.B.Narayana Murthy, sir, okay, for all this wonderful good occasion. As already YMCA, what YMCA is doing, what all activities is said by Mrs. Robin. Okay, and we have around more than 7 branches and 3 community centers and 2 high schools and high secondary schools providing schools. Okay, and we are bringing up, buildings in Kotiwakam and Rayapuram, and and also in other area. Okay, so new towers are coming up in a very near future. Within 1 or 2 years, they will be standing as a witness for the YMCA activities in Chennai. Okay, so we have around helped more than 15 lakh rupees, reached 25,000 people during this COVID time. We have provided our for the government given to the corporation for the market, to conduct the market in our place during this COVID crisis. And also first, we have entered to the Omundura hospital and provided the doctors with 500 new masks, and the gloves. Okay, so, and by the great efforts of our YMCA General Secretary, personal efforts, okay, we provided a lunch package for the policemen who are in services during this policemen, and also the uh, frontline workers of the corporation. Okay, they provided more than 2-3 months. Okay, and we reached around 25,000 to 30,000 people during this crisis time. So all these all these things are done by the YMCA. Very shortly I have done, and then Narayan Murthy sir is waiting for this, wonderful session, and we are also very much here, very much likely to hear from you the health, how to keep the health and all these things. Okay, I thank the Kilpauk always. It is a very active branch. I appreciate the team, okay, and Eric, Christopher, and also the chairman, Suraj sir, okay, for all the activities. Okay, thank you very much.
Thank you. Thank you, President Sir, for your presidential address. Thank you so much for joining with us and encouraging our Kilpauk branch always to do something for this community. Now it is my great privilege and honor to introduce the resource person of today's program, webinar, Professor V.B. Narayana Murthy, Consultant Plastic Surgeon, Kauvery Hospital and the SMF, Managing Director, NRA Advanced Women Care Center, Director, Eye Care Super Specialty Hospital, Managing Director, Lakshna Aesthetic Center, Private Center, and Vice President, Diabetic Food Society of India. Professor V.B. Narayana Murthy has completed 11th standard in the year 1977, All India Higher Secondary School examination, Arunachal Pradesh, and got into medical. He did his MBBS in Government Stanley Medical College, Madras, in the year 1977 to 1983, and secured third university rank and got winner in gold medal. In 1994 and 1998, the Royal College of Physicians and Surgeons they completed in Glasgow FRCS, and he got the certificate in plastic surgery in the year 1990 to 1993 at British Association of Plastic Surgeons and Royal College of Surgeons of England. He conferred the visiting and adjunct professorship for the work done in the collaboration with the Department of Diabetic Food for more than a decade, in association with the Indian Institute of Technology, Madras, in the year 2005. 2019, Sustrusha Professorship in Plastic Surgery by American Society of Plastic Surgeons at San Diego, USA. ICO Plastic Confederation of Fixing and Plastic Surgery Societies worldwide. Some of his professional experiences are from 1986 to 1994, various training posts in United Kingdom, leading to the award of FRCS and the certification in plastic surgery, BAPS and RCS England, and special training visits to Paris, France, New York, USA, and Oxford, England for advanced chronofacial and research techniques. Sir has got several patents, PCT application co-inventor, Pedo Power Graph, jointly with IIT Madras and the Sundaram Medical Foundation, patent for healing footwear in diabetic foot, patent for prevention of ulcers in diabetic foot, patent for design of the footwear, patent for SCLAB, a new instrument for EC microsurgery, patent applied for in the year 2016. Sir has been a member in various associations. His profile is a long profile that due to the time restriction, I just conclude my introduction about our resource person, Professor V.B.Narayana Murthy. YMCA Kilpauk and YMCA Madras is honored to have such an eminent profession during this pandemic period to address the gathering. Thank you, sir. Thank you for accepting our invitation. Now, may I call upon our resource person, chief guest of today's webinar, Professor V.B.Narayana Murthy, on stage. Thank you.
Thank you. Good morning. And at the outset, let me thank your chairman, Reverend Dorraj sir, for coming and speaking to us this morning. Let me also thank Advocate Martin Kennedy sir for taking this time and being with us today. And let me thank also Raju and Eric who are here. And my special thanks to Reni for giving a wonderful introduction. And of course, I wish to also thank Hilda, who has actually given us this opportunity to be with you. So with this few words, let me not forget Doreen for having us told about the YMCA and the various activities. With those few words, let me share my screen. Can you all see this? Hello? So what I want to do today is introduce you to the difficult topic of diabetic foot. And there are three things which you need to know. I would like to clear three things. One is, why is a plastic surgeon talking about foot, which may come as a surprise to many people. And what is diabetic foot? And the third thing is about our experience in COVID times. Now, before that, I would like to really thank again YMCA for the various service activities it provides. And I would like to also share my experience with YMCA. Since student days in Stanley Medical College, I used to visit YMCA. And I'll never forget my days going to London YMCA to have idli, dosa, and South Indian food in that YMCA, which we used to really long for and save our days to go and have food there. So with those few words, let me start off. So the topic is slightly different, because whenever you talk about diabetic foot, people say, oh, diabetic foot, your foot will be taken off. So I want to break the myth saying that whenever you have a problem in the diabetic foot, don't think about losing the foot. So say no to not having an amputation. But what is that you need to know is, you should really need to know what it is all about. So the topic is slightly to declassify and also demystify and take the fear out of the common prevalence of about having prevalence of saying that once you have a diabetic foot, your foot is taken off and you have an amputation. So if you know about your diabetic foot, it is very, very likely that you will be able to save your foot. The problem comes when you don't know. So to let the ball rolling, I would like to talk about three things. What is plastic surgery? Because it's a very simple thing which you need to know, because what we do is something slightly different, and I'd like to share what we do. And obviously, I'm going to talk to you about what is diabetic foot. And the third thing is going to be COVID, post-COVID, and we're all talking about the new term called the new normal. So the idea of the topic is, when you go home after listening to lecture, you should have a very clear understanding of what you should do now and what is the future going to be. And the future is going to be your ability to know a lot about diabetic foot, what to do when you're at home, what to expect when you're in the hospital, what to expect when you have a problem. So these are very simple things I'll tell you. I will try to show you a lot of photographs, and some of the photographs I have deliberately not shown you very, very, very nasty photos, but they are probably some of the decent ones. So with those few words, let me start off. So a plastic surgeon is one who is like a warship. He's got everything under his belt. So a plastic surgeon will operate. He will have to make sure that he'll do dressings. He'll have to make sure that for the diabetic foot, he gives you proper footwear. He will tell you what investigations to do. So it's not just coming to a doctor, sitting with him for 5 minutes, and then taking the medicines and go away. So what, as a plastic surgeon, and my interest has been to give you what's called a complete cure or complete solution for the problems. And if you see, when a warship goes, it is very important which missile is deployed first and which missile is kept last. So similarly, there are so many options available in a diabetic foot. We need to know which one has to be given first. Now, to just give you an example of what a plastic surgeon does is very confusing for most people. Even for doctors, you don't know. If you have a heart problem, you'll go to a heart specialist. If you have a nerve problem, you go to a neurologist. If you have a euro problem, you go to a urologist. So what is a plastic surgeon? To briefly tell you, a plastic surgeon is somebody who will treat a structural defect. Basically, as you can see, we also have a lot of ideas. So this patient who had all the 4 fingers taken off, the first finger was badly damaged, but the second finger was okay. So what we do is, here we do spare part surgery. So we took the middle finger and put it to the first finger, and then now he's got a fully functioning hand. So here we have restored almost 80% of the hand function. And this person who was working in a factory now has gone back to driving auto rickshaw and gone for a living. So this is how it is. So the other person here, he had a blast injury. Yeah, you can imagine this fellow who was about 11th standard. He lost his thumb. We took the big toe and then made it into a thumb. He finally went on to do his +2. Now he's a software engineer. So this is what we have a lot of ideas. So the same principles apply for diabetic foot also. Now coming to foot, we not only do diabetic foot, but also foot injuries. As you can see here, this patient who had a foot trauma, if you don't have microsurgery, it is very important when a patient comes to me as a plastic surgeon or as a doctor, for example, or even when somebody comes to you, you should know what he desires and what he deserves. So who makes the decision? So in diabetic foot or in medicine generally, as I see it, what you desire may be so many things, but what you have deserved, it depends on so many other things. For example, if you have a problem, you need to make sure that you go to the appropriate available expertise. In India, unfortunately, cost is very important, and therefore these 2 things are very important to take into consideration. So when a solution is given, it is not based on what you desire, but also depends on what you actually deserve. And these things depend. So if you go to the wrong person, you would like to have a foot properly restored. But if the expertise is not there, or the cost is not available or not possible, then you deserve something less than what you actually desire. So this is the first thing I look into. When a patient comes, we need to look at expertise, we need to look at cost, we need to take into consideration these 2 things. The other thing very important is, is a revealing statement. So stated needs and unstated wants. For example, if you see a patient coming to me, he is coming to me only because he's got a small ulcer in the foot. But that is not at all, that is one aspect. The need is he's coming to a doctor for relief in the hospital. But what he actually wants is that ulcer should not come again. Ulcer should be made sure that there are no complications happen. The patient doesn't want to come to the hospital again and again. So all the other solutions he actually doesn't tell. So it is important as a surgeon for me, I need to look at what the patient wants. So, and what the patient wants, most of them don't tell us. So what the patient needs, he comes and says, sir, my foot has got a problem. But what he wants is the collective decision of not only his, but also his family and other people. Because as I said, the cost is also involved, the morbidity is involved. So all these things you have to take into consideration. Let us say, for example, this patient is a very simple example where the patient came in. On the left side, you can see there's a patient who's got an ulcer. As plastic surgeons, I can heal it. As you can see, I did a procedure. The wound is completely healed. So this was my first patient when I came back from England. This is how the world was working. So the patient has got an excellent result. Wound is healed. But what has happened, 6 months later, the patient has come back with the same problem. So this is the problem with the diabetic foot. So who is at fault? Am I at fault? Or my methodology is at fault? The design is fault. So this is where I went into IIT Madras to look at, because foot is a mechanical device where you have to walk, put weight. So we need to know why is this coming back. So please remember, I always feel that when a patient comes to me, we'll have to find out what his needs are and what his unstated wants are. So coming to that, let me give you a simple example. Whenever you have a small wound, as you can see, a simple injury to the tip of the finger, if you just clean it up, first thing is to clean it up. the body will nicely build it up and heal it up, and finally it actually gives a nice polishing effect. So the body actually does. We don't do anything. All we do is just facilitate. So a finger which beautifully heals just by itself, that is possible because no major structures involved. If the injury becomes big, then you need to intervene, either a surgeon or a medication to intervene. So this is what we are doing. We are not doing anything. All we are doing is we are making sure the natural process of healing is facilitated so that the wound heals well. So to give you an example, it's very important for the common man to know what is actually happening. I'm not going to the details of how the wound heals, but as you can see, when you have a small injury, first there'll be bleeding. So within the first few minutes or so, the bleeding has to stop. Second, the thing has to build up, and finally the maturation of the, what you can say, the final touch-up has to be to happen. So any injury goes through these phases, and timing is very important. So most wounds should heal in about, as you can see here, most wounds should heal in about 10 days to 12 days time to 15 days time. So that is the timeline. So don't go with the feeling that, if you have a diabetic wound, it will go on for years and months. Not necessary. So as you can see here, as a surgeon, all I do is I help the cleaning, I help the healing and build-up process, and I help the maturation process. So as a common person, if you have a wound, you just imagine or you just see what I'm doing. Surgeon is doing only three things. He is only trying to mimic what the nature is doing, like cleaning, because you don't want the wound to get infected or contaminated. We are trying to help the healing process. So here you may find that your diabetes has to be controlled. You have to eat proper food. We have to make sure that you don't injure yourself. So this is all helping the nature. And finally, when the nature heals beautifully, then you have to make sure that it doesn't come back. So this is the very simple process of healing. Now we come to the diabetic foot proper. Okay, so it is a major problem, because it is not just one event. The day you are diagnosed as a diabetes, you go through a phase where you have no ulcer, then you have a phase where you have an ulcer, then after the ulcer heals, then you have a post ulcer. So this unveils over time. Slowly it will unveil. So the first pre-ulcer type, where almost 95% to 98% belong to this group. So you have to, don't worry. Most of them don't have an ulcers. Small percentage of them develop ulcer which gets infected. Subsequently, the post-ulcer is very important, because after the ulcer, when the wound heals, you have to look after it as well. So let us see what is a pre-ulcer. As you can see here, you look at the foot as various components. As you can see, the bone is a basic architecture. The architecture has to be covered with the skin. It needs nourishment with the help of a blood supply, and then it needs sensation. So these are the four components of the ulcer before the ulcer. So here you have to make sure you document what is done, what are the various aspects happening there. You have to give them footwear, which I'll talk to it later. Then you have an ulcer. What has happened in the ulcer phase is that the wound has come there, either because of injury or something like that. And they may be injury to the bone, injury to the blood supply, injury to the nerve, or to the skin. So this, everything gets involved once in a while. Here again, once the skin is lost, once you have an ulcer, then the bone is exposed or the deeper tissues are exposed, then you become prone for infection. Then post-ulcer, as I said, post-ulcer, again, the wound is healed, but remember that all the, what's called a PPG or precipitating factor, whatever caused it in the first place, can make sure that this can come back again. So recurrence is because of the previous causes which caused the ulcer to come. So let us, with those in the background, let us say, why does a diabetic foot patient comes to us? So he may come with severe discomfort, sleep disturbance. Some of them will come with tingling and difficulty in walking. Some of them have instability. Some of them will have sensation of walking on cotton. So many symptoms are there. And you can see that people will tell this in various ways. Some people tell that as if they are walking on hot tar on a Kathiri day. So they actually don't walk that, but the amount of distress they go, they compare it and tell you what is happening. Some of them tell you that there's pins and needles. And some of them tell you that it is so bad that it's like two electrical wires being pressed into the feet. So these are the various symptoms you come across with. In addition to symptoms, you have to look into the foot and see what is happening. As you can see, people can have small ulcers. people can have dryness, people can have swelling, and it can depends on which part of the leg it affects. And the patient has to see. The doctor seeing is different. The idea of my presentation is that you have to see yourself and look for all these things. So if you have some patients who have a lot of burning and all that, look for the foot and look for wasting. So you can see that the foot has become either swollen or there is some wasting of muscle. In the middle picture, you can see that the muscle is wasted. There's a divot or there's a depression. So that depression is important because it tells you that the muscle is lost. So this is exactly what the doctor sees. So what you see, only a doctor sees. So unless you see all the fit every day, you will not be able to tell the doctor. See what is happening here. This patient has got severe pain in the foot, but what else do you see? You see that the foot is so dry, completely dry. On the right side, you will find that the patient on the right foot has got some pain. He's got ulcer. On the left foot, he's got swelling. So don't ignore one foot for the other. Both the feet will have some symptoms, and it's important that you see yourself and then see. So when I said pre-ulcer, I said you have to document that you have to start doing. So as a patient, you have to have as much interest to see what is happening. What else you see on the left foot is very significantly, you see that the patient on the right foot has got hair, on the left foot they have got no hair. Every sign like this is an important indication for the doctor to see what is happening. So don't ignore what you see, and please document and tell us. Then of course ulcer. Very simply, as you can see here, this patient has got a small ulcer. Skin is the most protective part of the body. So skin protects you from the environment. It protects you from the bacteria and other things. And once the skin is lost, you expose yourself for infection. So this wound should not be there. You try to heal it as soon as possible. Now you need to be aware of all these things. If you see here, this patient has got an ulcer, but also look at the foot. Look at the four components: the bone, the blood supply, nerve supply, and skin. As a patient, I'll tell you how you can actually see what is happening to these four components. The foot, as you can see here, is actually curved the opposite way. Normally, you'll find the foot has got a curve like this, but here the curve is in the opposite direction. So here, the patient has got collapse at the arch, which means the bone is affected. You can see the foot is dry, which means the nerve is affected. You may find that the patient is saying that I got pain in the calf, and when I sleep in the AC, my foot becomes cold. That means the blood supply is affected. So all these things you should be able to find out. So here what has happened is, again, when you have an ulcer, there is exposure and possibility of infection. So a patient who has got an ulcer in the midfoot, if you take an X-ray, you'll find the foot is completely collapsed. I'll show you some normal X-rays, but in this X-ray, you can see that the mid portion of the foot is completely collapsed, is deranged, and the patient, instead of walking in the whole foot, is actually walking on the one particular point. So therefore, this foot will never heal. So this is what I said. So when you come to us, you want the wound to be healed, but I should also make sure that not only the wound heals, but I'll have to make sure that the wound doesn't come back again. So it is my responsibility to give you the complete picture. Then, of course, can you see here, this patient has got a small wound. The bone doesn't look okay. All of you now have got access to X-rays, everything. So some of these patients actually look at the X-rays. You can see that the patient has got a deranged X-ray, and therefore there is infection. Any wound which does not heal, as I said, if you look at the wound healing timeline, most of the wounds should have healed in about 1 month, 3 weeks or 1 month's time. Anything which goes further, which means there's some problem. Here you can see the patient has got a small hole, and the wound has not been healing for about a month to 2 months. Now, as a surgeon, we just explore it and you find that a small piece of stone or some material which is there. Until that comes, it won't come. So it's important that when the wound does not heal, you seek proper medical advice. Very commonly, you'll find, most of us would have noticed, when you're walking around, you would have had a knock on the little toe, and there will be a small injury. So don't forget to mention this to your doctor. As you can see here, this patient, the little toe, there's a small break. I think most of you can see there's a small break in the tip of the little toe. Most of us will, and there may be a small wound. So this wound, this patient was dressing for almost 3 months. And as you can see here, that small piece of bone was infected. And unless you remove that bone piece, this will never heal. So through a small procedure, we removed it, and you can see that this wound will heal in about 5 days' time. So the idea is, as I told you, remember there are 3 things. One is cleaning, Second thing is building up, and third thing is healing. So unless you take these three things together, the complete thing will not happen. So here what has happened is the cleaning has not been done. There's a small piece of bone which is inside the fracture, which is not united, and therefore that is not healing. So once you clean it, this will actually heal in 5 days time. The other thing which I want to warn you, anybody who comes and says he's got redness on the foot, please don't ignore, because in diabetic foot, this actually is not just a small infection. This would have affected the whole foot. So this is what you should be aware of. Whenever you look for signs like this, make sure that you see the doctor immediately. You would have known that people who like this, they'll suddenly say, sir, yesterday it was like this, today it's become bad, and the doctors told me to remove the foot. So this can happen. So that the patient should be aware that anything which is red, and you'll realize that in diabetic patients, they may not have fever. So therefore, if you have fever, if you have pain, if you cannot cope yourself, we come to a doctor. The saddest part in diabetes is they don't have pain, they don't have fever, they don't feel well, so they don't come to the doctor, and then it becomes more. Now, these are some of the things which I say these are potentially infected. So this, a lot of patients will have this sort of a small breakdown in the skin, they'll ignore, and suddenly they come with an infection. Another small example, this patient was walking, he had a small injury, he did not know what happened. This has been going on for about 6 months actually. Dressing and dressing every day, but you'll find that when you put a small probe and see, it's a huge area, entire left side of the foot is involved, and unless you treat it properly, this will not heal. Again, people who have small ulcers, you may be doing dressings every day, suddenly you will find there's a foul smelling discharge, there's a white discharge, a black discharge. So this patient had a successful operation, and then he went for some pilgrimage, he got injured, and he developed small discharge. As you can see here on the right side, the bone to the little toe is become very thin. That means he's got bony infection. So whenever you find some change to the existing ulcer, please get to the doctor to get proper direction. Again, you'll find that most wounds are dry. When the wound becomes wet, that means it is becoming worse. Now, don't ignore these wounds, because they become what is called the recurrent infection. They again get infected. Then one fine day it becomes so big that it become much more than restricted to the foot. This I always show. This patient had a small injury to the back of the heel, a small wound. He has been going on for 6 weeks to 8 weeks, not healing. And you'll find that all we need to do, that there's a big tendon, as you know, that tendon is involved, and unless you remove this tendon fully, right, and then close it, in 5 days time, I can tell you this wound will completely heal. So there is no need to suffer. There is no need to keep on allowing this to go on. So again, go back to what I told you before: cleaning, healing up, and then healing. So build up. So what we have done is basically clean it up. So unless you clean it up very well, this is not so. First stage, if you clean it up, healing up, this particular patient did not require, but some people do. And third thing, it will heal up. Don't forget, all of us wear footwear. A small injury from the strap or the footwear on the top of the foot, this can become, as you can see here, that this patient has got a small pus there, but you can see the redness around going up to above the ankle. So anything which happens like that, as I told you before, don't ignore these things. Now coming back to our situation, as you can see here, I'm sure as YMCA you'll be dealing with a lot of your own people who are in need of all these things. Now we cannot put Western perspective to India, because this is the downright reality. Patients are diabetic, patients go in overcrowded trains, they live in very nasty situations. Some of them don't have footwear. So I may do a fantastic research and give them a footwear. The West does a fantastic research. As you can see here, at the end of the day, this is a nurse who works from home. She has to do night duty. She cannot afford anything. So all we did was to offload. We gave her a plaster to make sure that the patient does not put weight on that ulcer. The wound is completely healed. But the point, look at the condition of the plaster, right? Because she has to go to work, she walks in the sewage, she walks in the road, and whatever. And then this is the condition. But still, if you protect the ulcer, it will heal. This is what happens. So now, does my role end there. As you can see here, this is one of my first patient whom we treated, and you can see that the patient has actually had a proper footwear. The ulcer has not come, but most of us do not know. As I told you before, a lot of these patients have sensory problems. They have pain, they have loss of sensation, they have numbness and all that. When that happens, as you can see over the course of 10 years, the same patient slowly has become from a normal foot like this. This is operated. As you can see, the foot is becoming more and more and more like leprosy foot. So diabetic foot becomes more like a leprosy because they also don't have sensation. So this is when I said, look at this, a foot which was nice here has become like this in 10 years. So this is not very good. So what we have to do is to look at everything. So I told you before, as a patient, you should know what is the condition of the bone. If you have any abnormality, any deformity, that means the bone is not okay. If you have numbness, then the nerve is not okay. If you have an ulcer like this, then the skin is not okay. So these patients require either surgery or treatment for the nerves, the bones, and more importantly, the footwear. So this is what we did. So here, as you can see, this patient had we actually corrected the nerve here, and you'll find that the ulcer is slowly healing. This is a classic example of a patient. As you can see here, he's had a lot of tingling and pain in the left foot, and then we operated on the left foot. And the patient, this is very classical because very rarely you see these patients. This patient has got severe symptoms on left foot, so we operated on a Friday. Monday morning he ran and came because the rat smelling the blood here has tried to nibble the big toe, but because he got sensation back, he was able to withdraw the foot. But the rat very comfortably ate off most of the big toe. So this looks very, very nasty, but the people who have very bad nerve disease can be reversed. So this is what I want to say. Nerve loss causes for rat bite and tissue loss. And then because on the left side we reversed by doing a nerve surgery, the patient does preserve the foot, but here he has got injury to that by the rat. So nerve repair has to be thought about. So again, I'm telling you, most of you should know what is the condition of the foot. So this is a very simple color-coded mechanism of finding out what is the status of the foot. So as I told you, if you look at the foot ulcer, if the ulcer looks pink, that is a good sign. So we call it a good pink sign is a good sign. Then you'll have wounds like this with multicolors, right? So here you can see there is some black, there's yellow, there is green, all those things. Then you have the black. So I'm giving a very simple method of finding out what is the type of wound you have. So if you have a pink wound, be happy. Okay? If you have a wound looking like this is the worst wound you can have. So here you can see there's multiple colors, and the redness here, it has spread along to the thigh. This is the worst wound you can have. And then this is a black wound. Black wound means there is no blood supply. That's all. A red wound is a very good wound, which means that the wound is nicely healing. This is what we like to see. This is a yellow wound, right? As you can see here, this is a very bad wound. There are some red areas and yellow areas. So this is so look at the wound and you'll know what type of wound it is. So pink is good, red is good, yellow is bad, green is bad, black is okay. So coming back to this, so stated needs. So stated needs is the patient came like this, we given him an excellent result, but he has come back 6 months later with a problem. So what did we do? We need to give them proper footwear. As you can see here, this ulcer, all we did not do any operation. We always try to give them a proper footwear. As you can see here, this is the underside of the footwear, is a modified footwear. The patient is walking only on this, and this, which means that he is not putting weight on the big toe. When he does that, the wound will actually heal. So this again, as I told you, the same patient whom I did, she came back, we operated, then we gave her a proper footwear. Again, you can see the patient is not putting any pressure on the ulcer area, and therefore this continues to heal without any problem. That patient, again, I showed you, this patient who was developing ulcer, we gave her a proper footwear, and then she managed to heal without any problem. Again, as I told you, this is an abnormal area for a foot ulcer. She had this ulcer here. She went and got operated, which is not necessary. We gave her a proper footwear. The ulcer completely healed. We also do pressure studies to find out if the patient, when he's walking, has got increased pressure, lower. This we can predict whether the area of the foot is going to get worse or not. So if you have a red area, these are all hot spots where we can give them proper footwear so that these toes and the big toe and the base of the big toe does not get infected. Most important part of the footwear is, if you see, this is actually my own foot. Ironically, I went for a diabetic foot society meeting in Hyderabad. I was coming back from the flight, and I sat in the flight, and I put my foot up and I saw this. Sorry. I saw this pin here. Can you see this drawing pin? Imagine if this has gone through my foot, and if you're a diabetic. So footwear at least prevents acute penetrating injuries. If not anything else, it will actually prevent acute penetrating injuries. As I come back again, we cannot give this sophisticated footwear. This footwear in the West costs you about 10,000 rupees or 12,000 rupees, and therefore you cannot use this in our patients. So we need to give them something which is affordable. This is the cheapest form of thing which we give them, a plaster, but this we cannot give it to everybody. So I do release of nerve surgeries. Nerve surgeries can help to make sure that the nerve is restored. You can see here this patient had nerve surgery on the left side. He's got no ulcer on the left side, but he went for a long walk. He's got ulcer on the right side. So when you do a nerve procedure, in some people it can restore your nerve. So imagine if you have an ulcer, you need to look at the bones, you need to look at blood supply, you need to look at nerve and skin. So all these things you have to take care. Again, this same patient here on the right side, he's got ulcers. The left side, he's got no ulcers. This was published later. This was published subsequently in a journal, as you can see here. This is the first publication after long follow-up. So what I want to say is, a plastic surgeon has got so many things under his belt. It is very important what I deploy. If I deploy something which is not appropriate at the inappropriate time, or the idea is to apply the right thing at the right time, so that we are all battle ready, but the timing is very important so that recurrence and everything can be prevented. So what does the patient has to do? The patient, as I said, I'm going to be very simple only. It looks like a big table, but very, very simple. So as I said, you have various components. You have the ulcer. I told you what are the types of ulcer you can look at. Okay, so the ulcers can be red, normal, red, pink, black, yellow, and green. So when you look at the ulcer, you know where else. So you explain to me. This I am preparing you because in COVID time, this is how we treated patients. We could not see patients could not come. So we empowered the patients to look at their ulcers and find out what color. Simple, just look at the color of the foot and say what it is. So depending on that, I can tell you what it is. So if it is red, I will say this is what you should do. If it is green, I'll tell you what it is. If it is yellow, so the first thing you need to look at is ulcer. Then you tell me whether there is any bone extra is involved. So this again you are seeing at home, because most people could not come to the hospital. We could not see. Photos can be sent, but this classification is a very simple classification which will tell you where you stand. The patient becomes empowered. Patient also can tell us what is happening. So this is as far as the ulcer is concerned. Next, I told you about nerve. I told you what symptoms the patient can tell you. The patient can tell you pins and needles, dryness, absence of sensation. Forget all these things. Just look at the first thing, what it described. Then I told you about the blood supply. Patients can have pain. Patients can have blackness, right? So when you have this, you let us know. Then I told you bone. Osteopathy means bone. If there's any deformity, there's any swelling with ulcer, then you let us know. Infection, I told you, if you have redness, if you have gangrene, and more importantly, at the time of COVID, it's very important that whatever you see in all these aspects, you'll have to tell us whether you have fever, you have breathlessness, you are tired, loss of appetite. So this gives us this gives us a clue whether you are having early COVID or whether you're having just the complications of diabetic foot. So as YMCA, I think because all you people may be interested, I can share this thing with all of you. We will take some measures to make sure that every person is educated properly. I will share this chart with you. All of you can become extremely educated about your foot. The very simple column. So this is it, very simple. So this basically says what you do, what the doctor sees, what investigation we do, and then what surgical treatment or medical treatment. This is what exactly we plan. Then, sorry. So third stage is what we are looking at. Let's to get the last stage. I told you about plastic surgery. I told you about the foot. Now we need to know what is COVID, what is post-COVID, and what is the new normal. So this I had devised another simple chart here. I will go through based on the experience. This is all developed recently. So here you can keep it in your hand, or we'll send it to you. Very simple. So as I said, you can have wounds, you can have no wound. This is the pre-ulcer group. This is the post-ulcer group. These three are the ulcer groups. I'll tell you what it is. So if you go to the first group, this group, 92% of all diabetic patients actually belong to this group, which means you have no risk, you have no wound, your foot is normal, your organ systems are normal. What do? You can call up your doctor and then you do a teleconsultation. So this 92% of diabetic patients belong to this first group. Second group is what I told you, the post ulcer. This is patients who have already had an ulcer. These patients can be worried because they already had an ulcer, but the foot is only at risk. There is scar from the previous healing. Then you can do either we can send a nurse or somebody to see at home, or actually you can come to the clinic and then we will have a look at you. So these two are very clear. So this is 92%, this is another 3 to 4%. So we are looking at another small percentage of really sick people during the COVID times, or actually even the future, how we're going to tackle it. So here, if you have an existing wound, remember I told you, if you have a pink wound or if you have a red wound, it's a good one. If you have a black wound or a green wound, that's a bad one. If you have a black wound, multicolored wound, that's a really bad one. So you have an existing wound, and with the treatment, the wound is becoming red. I'm happy because you can come to the outpatient, you can come to the clinic, or we can send the healthcare worker and you get a good result. If you have a black or a green wound, three things I told you. Remember, if you develop fever, if you have breathlessness, think about the possibility of COVID, you need to come to the hospital. The last one is, if you find there is blackening, if you have fever, you have breathlessness, also you have sudden appearance of redness, swelling, pain, discharge, then your foot becomes critical. You have to come to the ICU, you have to be checked for COVID, and then you have to see how to proceed. So let's say, for example, this patient has got multiple callosities. So this is not urgent, right? So what I would say, this is only a grade 1. I will treat him properly, reassure him, ask him to be happy, nothing to worry about. This is potential, right? Again, make sure that you wear proper footwear, moisturize your skin, and then you can come to the hospital or you can have a teleconsultation. So this one is an existing one. The previous one I showed you the existing wound where you do a routine examination. The wound is fine, it will heal. This is again slightly this also you can look after it by routine examination because the wound is red. So what do you mean by routine? What does the doctor do and what is it you have to do? If you have a routine procedure and then if you need a surgical procedure, then we check for COVID, we wait for the results. Then if the operation is not if the operation is not urgent, then you can go for quarantine and then you can come back later. So it's very important to know what is your status during quarantine time, how to treat you at the time. So the most important thing I want to tell you is don't worry. Most COVID patients get better. Only people who are very, very sick because of so many other conditions, they get worse. So if you have a wound, if you think it has to be checked for COVID, be very brave. Just get your COVID test done. If it comes back a positive also, don't worry, you'll have to go to quarantine. Your ulcer does not require any further treatment. But let's say, for example, you have seen a wound which has got danger signs, but also you started developing fever and breathlessness, then becomes emergency and critical. See here, this patient, as you can see, he was like this. Then it has become multiple colored. Okay, he had to be tested for COVID. COVID was positive. With all the tests, we had to go ahead and do the operation with the thing. So what is that we do? We test for the COVID test. We go through a full protective gear, and we have to operate, and then the patient get better. Now, most important thing is, if the, as I told you in the beginning, the name of the game is being able to tell people how much of information. Unfortunately, during this COVID time, we are able to spend more time with the patients and the relatives, and the acceptance is more. So that's a positive effect what I felt during the COVID times. I wish that we do that more in the future. So these are all the various things I told you. Some patients we have been, as you can see, this patient, we have followed him completely. Over the last 60 days, the patient completely healed. This patient, unfortunately, as it said, he's got black. Sometimes these cannot be salvaged. He's an 80-year-old man. He had so many other conditions. We did a below knee amputation. COVID was negative. Patient went home. So we had huge amount of experience managing diabetic patient during the COVID period. So don't worry. So with those few words and a few things, I would like to end my talk here, and I'm ready for some questions.
Thank you so much, sir, for sharing your time with us, and you have given us a very good description about and it's like a mind awareness creation of how we should do and how to take care of us during the diabetic mellitus. And a lot of questions are being asked by many people, so I'll
Okay.
ask you the questions whatever they have asked. How much water has to be consumed daily?
Right. See, water is a very important thing. If you are a diabetic and if your sugars are well under control, just go by your instinct and drink how much you can. If you are a diabetic and if your sugars are not controlled, then what will happen is you'll actually be passing a lot more urine. And the more urine you pass, you'll become more thirsty. So one of the classic symptoms of uncontrolled diabetes is polydipsia and polyuria, which means you pass more urine, so you also drink more water. So how much water you drink, go by the instinct, because sometimes you should not become dehydrated. But please check with your physician. If you also have kidney disease, diabetes, kidney disease, then you have to be very careful, because if you don't have kidney disease, you can drink enough water, it will pass out through the urine.
Okay.
But if you're having a lot more thirst than usual, then you have to check your blood sugars, because the sugars are high, then you'll start passing urine. You control the sugars, then your thirst will become less.
Okay.
But you also check your urea and creatinine for the kidney function, otherwise they'll also become much worse.
Okay, thank you, doctor. There are 20 plus questions. I'll ask you a few. I'm like Ramnath sir has asked a question. He has pricking feel and irritation and burning food. These are the symptoms for diabetics.
Yes. See, these are one of the first symptoms. When you have irritation, prickling, burning, without loss of sensation, then you can possibly be in a state where the nerve can be treated properly.
Okay.
So this has to be investigated. I'm sure that we have a few simple tests. We do the test to find out whether you have the nerve is being affected. So various symptoms are there. These are definitely symptoms of a diabetic foot. But again, there are other reasons why you can have diabetic foot. If you have poor nutrition, if you're not eating well, patients who are on some medications, some medicines can cause the same things. Age itself can cause. So it's very important that you check it up. And diabetes alone cannot produce, but others also can produce it.
Okay. Not having any wound. Why foot pain is occurring? In that time, what we should do?
Good question. See, yeah. This is the paradox. The paradox in diabetic foot is, even though there is no injury, you have pain. So even though you don't have a wound, you have pain. So that is the because the nerve gets irritated. So constantly the nerve gets irritated, therefore you get pain. So that's the reason why you don't have.
And the next question is, what is the reason for sugar complaints during pregnancy?
Right. See, what happens is, in a small group of people, as you know, that pregnancy itself is a very joyous occasion, but also for the body it's stress. So it may be a very good occasion for all of us, but the body undergoes a lot of stress and strain. So whenever there is stress like that, then the diabetes can come. So in a small percentage of people, once they have diabetes, once they have pregnancy, in the later stage, they can develop diabetes.
Okay. The next question is that could you suggest what is the food or food chart to be prepared for diabetic patients, especially during this corona time?
See, the
Like
food,
three people have asked
the,
the same question.
the food in diabetes is very simple. Make sure that the amount of carbohydrate you take is very less, which
Okay.
means that everything which is white in color, sugar,
Mm.
flour, white
Mm.
rice, all those things you have to reduce. So they're all high carbohydrates. Reduce the
Okay.
amount of carbohydrates, increase the amount of fiber, which means you have to take a lot of vegetables. You can actually take non-veg also, but
Okay.
you have to include enough amount of greens, vegetables, and not much fruits, but definitely one or two fruits you can take. But very important that you have to increase the amount of greens,
Okay.
decrease the amount of white food you take.
Okay. Okay. Could you suggest what are the fruits that would be suitable for diabetic patients? Fruits.
Yeah. See, some of the fruits they suggest is fruits which have slightly higher water content, right? So
Okay.
any fruit like orange juice, orange is very good. You should not take juice, but you should take the whole orange because
All orange.
the whole fiber is there, and then it's got high amount of vitamin C,
Mm.
and also it's got low amount of sugar. So
Mm.
all orange you can take.
Mm.
Try to avoid solid foods like papaya, mango,
Mm.
jackfruit, high sugar contents. So those
Mm.
things you have to avoid.
Okay. The next question is that stevia, stevia sugar, like it's tasting like it is tasting like sugar. Is it safe to use that during diabetics? Stevia.
See, these are all sugar substitutes. They are
Okay.
okay, but you say you cannot use that for making, let's say, rasgulla. Okay, you
Mm-mm.
cannot make that to, but they are used as a small supplement. For example,
Okay.
if you are drinking a lot of tea and coffee, you don't
Mm-mm.
want to end up putting too much of sugar. So
Mm.
ideally, if you want to do that, then you just put a small amount of this to give you
Mm.
the sweetening effect. That's all.
Okay.
So that is
Okay.
all you can do.
Okay. And sometimes I have a lot of pain from knee to foot. Is that the cause for diabetics, or is it a symptom of diabetics, and what should I do?
See, knee to foot, usually the pain in diabetics is mostly restricted to below the ankle joint. So
Below the
yeah, mostly. But again, if you have this, you need to check it up. You may have problems in the back. There may be nerve entrapment, what we call it, at the back of the back in the back, or you can have some other problem. You can have knee problem itself. So knee pain is slightly different. Not
Okay,
very common in diabetes.
thank you. And then the next question is, sir, what is the ointment that they could use? Ointment and footwear for diabetic patients if they have a
Right.
wound.
There are two ointments you have to definitely use. One is a moisturizing ointment. As I told you, I showed you some pictures where the foot is very
Mm.
dry. So you
Yes.
had to use some sort of any moisturizer is okay. Most of the moisture available, you can use them. They will actually moisturize the foot. So if it
Mm.
moisturizes, it prevents cracks. If it prevents cracks, it will prevent infection. So that is the first thing you have to use it, which is
Okay.
very, very important. Second thing is there are ointments when you have small scratches and small wounds,
Mm.
which are to prevent infection. So that's
Mm.
another different group of ointment which is available. Then the third group of ointment is when you have severe burning pain. So this is the three different types of ointments you have, which we
Mm.
use. So depending on what condition you have, you can use all these things. So you need to really see, as I said, it's very important to know what is happening to your foot, whether
Mm.
the nerve is involved, whether they have blood is involved, bone is involved, or skin is involved. So these four components you have to check it up.
Okay. The next question, sir, if I have a diabetics, is there any particular footwear that you recommend to wear?
You need to one is you need to make sure that, as I said before, you need to make sure that the rice and other thing you don't take. You can take
Footwear.
footwear.
Yeah.
Yeah, the specific footwear is what we call, you have to check the hardness, which is called it is hardness. You
Okay.
don't check it with your hand because that can give you a wrong this thing.
Okay.
You need to check the ask for the footwear manufacturer whether you have a hardness of 20. Anything
Hardness.
more, hardness of 20. If you wear footwear hardness more than hardness of 30, 40, then your
Mm.
foot will get injured.
Okay.
Similarly, your hardness should not be very low also. Most of the time people say it's very soft. And if you wear the soft one, that's also very dangerous. So you should not wear a very hard or soft ones.
Okay. The next question is asked by Mohana Priya ma'am. What will you advise for a gestational diabetics patient in their diet?
See, I think I'm a surgeon actually, so I don't.
Okay.
I don't.
Okay.
I think you need to ask your gynecologist.
Yeah. Okay, sir. So would always I have a kind of itching. I don't have a diabetics. Whether is my itching on my foot could be related to, or could it be diabetics?
Itching is a very common thing, and I think most commonly the reason for itching is dryness of skin. So if you actually moisturize the skin with any moisturizer that you have, that'll take away most of the itching problem. If it is still persistent, then you may have to take some medication. But again, you see, a lot of these things can be because the food you take, because of the footwear, there can be allergy. So we don't know. So this has to be checked by the doctor, and then you can be treated accordingly.
Thank you, sir. So even for cracks, you suggest moisturizing ointment. Any moisturizing ointment?
Crack. We have you have a lot of. You can use the what is available in the market. Crack is also very good.
Okay.
You can actually use that. But the most important, as I said, remember what I said. One is the cleaning. Most of the cracks you'll find there's a lot of mud inside. There's a lot of dirt inside. It looks black. So the first thing is cleaning. You have to make sure you clean the foot properly with lot of proper. You just soak the foot for some time. If necessary, use a soft brush. Right?
Okay.
Use a soft brush and then clean up the crevices. You can't expect the thing to heal when the crack is filled with mud and things like that. So first thing is that to clean it up. After you clean it up in the night, preferably soak your foot for about 5 to 10 minutes. Use a mild soap and remove all the dirt. Then you put a moisturizer or a crack cream. It'll heal. It'll work wonders.
Okay, thank you so much, sir, for sharing your valuable time with us. And it's really like awakening moment when you show the pictures. Even though they are diabetic patients or non-diabetic patients, we need to take lot of care. Even though if you go to a hospital, we will not have so much of time to speak, to get a lot of insights from a doctor. And we would, like from YMCA Kilpauk Branch, we wholeheartedly thank you for all the time you have spent. And we had more than 700 viewers watching the video, and most of them, they have told very good feedback about you, and they were asking for the food chart. So participants, we have shared the feedback link. We have shared the feedback link in the chat box. Kindly fill in the feedback link. So for all the participants, give your correct email and your mobile number. So to your email, as a doctor, he shares the food chart. We'll be sharing it into your email. So kindly take care of your health during this pandemic. Taking into these consideration, like YMCA Madras Kilpauk Branch, we have organized it. And we once again thank our doctor for sharing his valuable insight. And this video will be on live. And whenever you want, you can share it to your friends, to your relatives who have got a lot of doubts. It's like most of the questions are answered. He started from like even for ulcers, the doctor has showed different colors, like what each color would look like and what it is all about, like red, pink, black, yellow, green, and what is infectious and what are the steps to take care of it. So you all have got a greatest insight from a predominant doctor from Chennai. We thank you, doctor, for sharing all your insights. Now may I call upon our YMCA Madras Kilpauk Secretary, Mr. Eric Christopher, to render the vote of thanks.
I'll share the chart with you. It's very, you can give it to anybody. I will give a small sort of explanation how to look at it also. It's very simple.
Thank you, sir. Thank you. Sure, we'll be sharing it. Christopher, sir, could you switch on your mic, please, sir? Yes.
Thank you. Thank you, ma'am. Good afternoon, one and all. I'd like to thank God and praise God for giving me the opportunity during this lockdown period to do the awareness program such to this platform. So today the doctor gave a very informative information during this lockdown period. So I think so much of very much benefited through this program. And also I'd like to thank General Secretary P. Asit Pandian and CEO and Board of Directors, Advocate MJ Martin Kennedy President of YMCA Madras, and the Vice President Selva Kumar and Benjamin Franklin sir, and Dr. Vincent George sir. Those who have encouraged us to arrange as a team to work on this second webinar through this platform. So I thank Dr. V.B.Narayana Murthy, give the vibrant and effective interactive session. So thank you so much, sir, for your information.
Thank
and
you.
Also thank Dr. Rennie Robin, sir, and Mrs. Dory Robin for doing the MC, and also the technology who has assisted to this program. Once again, I thank all the YMCA members and the viewers of the YouTube channel, and also thank all the members of the viewers. Thank you, ma'am.
Thank you.
Thank you so much, sir, for your word of thanks. And we, on behalf of YMCA Madras Kilpauk, we extend a very thankful note to all the participants who have viewed this, and we encourage you to share this YouTube link to your friends, relatives, to whomever you want. You can have it in your status also. You can subscribe to the channel. You can like the video so that people will get enriched. And from a wholehearted, from a bottom of our hearts, we thank our doctor for sharing his valuable time with us, because we cannot meet a doctor during this COVID, and we cannot get so much of insights about diabetic mellitus. Right? You have shared like 360-degree, and also you told us the prevention methods, and a lot of people they told us thank you, sir, for doctor for organizing, for sharing all your insights. Many of their questions are being answered. And participants, we request you to fill in the feedback link. You will be getting your e-certificate by today, and once we receive the food chart from a doctor, you will all get it in your email also. Kindly follow it, share it to the best of your ability. Thank you all. God bless.
Thank you very much. Thank you, Dory.
Thank you, sir.
Thank you.